Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our special guest today is Dr. Joseph Maroon, clinical professor and vice chairman of the Department of Neurosurgery at the University of Pittsburgh Medical Center. Dr. Maroon is the team neurosurgeon for the Pittsburgh Steelers and vice president of the A4M. We'll be back with our interview after this brief message from our sponsor.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
We are so pleased to welcome Dr. Joseph Maroon today. He has over 40 years of clinical experience and specializes in minimally invasive surgery. He is a sports medicine expert and innovator in concussion management, personal fitness, and nutrition. Welcome today. It's so nice to talk with you.
Thank you, Melissa. It's always my pleasure.
We wanted to cover a few topics with you today.
Sure.
So much has happened in the last year and a half with COVID and everything. How have you adapted with your practice and your patients?
Well, it's been horrendous, to put it bluntly. The problem in hospitals now is just horrible in terms of hiring people and nurses, surgical techs. It's been as bad as I've seen it in my whole career. Not very positive, obviously, but it's been very, very bad. On the surgical side of things, everybody's had to really compromise in terms of their ability to get into the operating rooms, to take care of patients in the way they're accustomed to. But we're managing and we're coming out of it, and there's light at the end of the tunnel, hopefully.
Mm-hmm. Yes, hopefully things will be changing for the better. Also, earlier this year, you co-authored an article in the Frontiers in Nutrition journal on the benefits of ketogenic diet for malignant brain tumors. Can you expand on that a bit?
Sure. The treatment of malignant brain tumors, glioblastoma multiforme, as they are called, has advanced very little over the last 50 years. We've added a few months to the lifespan, generally speaking, but very little else has been successful in this terrible disease. And Dr. Thomas Seyfried at Boston University, for the last 15 years, 20 years, has been pioneering what he describes as the metabolic approach to cancer. And this is an approach that involves using the ketogenic diet. And as you know, cancer is a new development in an old body, and I'm talking about evolutionarily old body. So that when we were on the savannah in Africa several thousand years ago, it was feast or famine. So when we feasted, we would store up fat. In terms of famine, it would be broken down, and when fat breaks down, ketone bodies are made, and the brain and body can survive to a significant extent with ketone bodies. Tumors, cancers, on the other hand, are totally dependent on glucose. That's why PET scans show up tumors that ingest or metabolize the glucose in the body. So by using a ketogenic diet, you are basically depriving the tumor of its basic metabolic substrate, glucose, and yet still feeding the body. So that it's a strategy that, in conjunction with standard of care, we've seen some dramatic results, but by no means is it always successful. But it's a consideration, it's a work in progress, and it is a strong consideration for somebody who has a malignancy. The presentation of a brain tumor can be in any of many ways. It may be precipitated, the diagnosis by a seizure that someone develops, chronic or intractable headaches, difficulty with memory and processing information. So many symptoms can lead to the diagnosis with an MRI or a CAT scan.
Okay.
In fact, I'm presenting tomorrow a presentation at the A4M. There's a discussion on the connectome and how it relates to behavioral disorders, and discussing psychosurgery and neuromodulation and psychedelics. Yes, it's a broad subject, and but what I've tried to do, what I will do, is to put all that together and present an overview of newer concepts in how the brain works, how we function, how psychiatric diseases and conditions and behavioral disorders are disorders of networks. We have 86 to 100 billion neurons in our brain. Each of these neurons is connected up to 5,000 or 6,000 additional neurons called synaptic connections. All of this, and there's over 100 trillion synaptic connections. So these come together in fiber tracts to form networks. And they're major networks, 10 to 15 of them, that really determine who we are. Our feelings, our hopes, our dreams, our pain, our sorrow. And these networks and the connectome, which is the wiring diagram of the brain, so how is it put together? How are we who we are? Well, it begins in utero with the care or non-care that the mother, the things she ingests, the exercise she gets, the stress that she experiences. All of these can affect the wiring diagram of the fetus. After we're born, the diet, and then the environmental factors. How much stress is in the environment? Is there any abuse? Is there exposure to violence? These are all things that get encoded in our synaptic connections, which form our fiber tracts, so that psychiatric disorders are really disorders of networks and synaptic connections. And with that kind of an approach, it's you see people with problems and they say, oh, it's all in their head. Well, it sure is all in their head. But it's wired into their brains, into their connectome.
It seems like this disproportionately affects low-income people. Do you find this to be the case?
You're exactly right, Melissa. That's very astute on your part. We frequently talk about an enriched environment for kids. Toys, baubles, bangles, beads, play toys, the mother's reading to the kids, the father's reading and playing with an enriched environment. And we know we can actually look at neurons and their connections with other neurons. And I'm going to show a picture of a neuron in a non-enriched environment in which there's no touching or cuddling or warmth or love. and then the neurons in an enriched environment with their arborization and their multi-connection. So again, the environment from 0 to 22, when our brains are continually to develop, that environment sows the seeds that will determine our emotional response to trauma, our emotional response to other human beings, how we interact with people, and also the primary emotions, what makes us mad, sad, glad, angry, and fearful. All of this gets wired into the connectome by environmental influences, which are also called now epigenetic. Our genes are like a blueprint of a house that you put on a table. They don't do anything until they're acted upon. Those factors that act upon the genes that I was just alluding to are called epigenetic factors. They instruct the genes which of 100,000 different proteins to make that form our hormones, our skin, our hair, our heart, our muscles, and such. So it's genetic and epigenetic, nurture and nature. Subjects debated since we swung down from our arboreal habitat on the savanna, and still confronted with, even more so today perhaps, with the incredible society in which we're existing in. I put a lot of this down in a book that I wrote entitled Square One, A Simple Guide to a Balanced Life. It's available online. And Sanjay Gupta, the CNN commentator, and another neurosurgeon, by the way, and friend, said this book has already changed my life.
Wow.
And I say that because it encapsulates what I've been thinking and working on for most of my career, in terms of how to avoid burnout, how to survive burnout if it does occur, and the incredible importance of aerobic activity, the right diet, avoiding environmental toxins, drugs, alcohol, polluted air and water, and also controlling stress. Stress is a neurotoxin to the brain. It literally destroys cells in our hippocampus in particular that subserves memory. So people under chronic stress really have a mild form of dementia in terms of their memory. And a thing that I'll be discussing tomorrow also is the brain's phenomenal ability to heal itself and to get rewired, the so-called concept of neuroplasticity. Heraclitus, a Greek philosopher, 400 BC, said you can never put your foot into the same river twice. Do you know why, Melissa?
No,
Yes,
please let me know.
Because the river's constantly moving. It's constantly changing.
Sense.
It's never the same river. Your brain, that's basically the definition of neuroplasticity. Your smell, your eyes, your seeing, your hearing, your touch, your taste. The five senses are constantly inputting photonic and electrical stimulations into our brain to form synaptic connections. So after this interview, you are not going to be the same person, and neither will I. It's not the same river. We will have been modified by the environmental and experiential things that we are doing right now. This is every day of our lives. The point being that the brain can heal if you put in the right input and the right environment.
So speaking of all these healthy activities and healthy habits, you just came first in a Florida triathlon, which is amazing. So congratulations.
Well, thank you very much.
These often?
Going back to exercise, and I started doing triathlons and racing 35, 40 years ago. And it saved my life at one point, which is the topic of the book, basically, and it resets your chemical balance, your neurotransmitters, with physical aerobic activity. And I've been fortunate. I've done 8 Ironman distance triathlons, and as you said, I won first in my age group last month in St. Petersburg in a Olympic distance race. But to be very honest with you, Melissa, I wouldn't tell this to anybody else. I was the only one in my age group as well.
Well, you didn't need to mention that, but that's all right.
But I was first.
You came in first. That's all we need to know. Well, thank you so much, Dr. Maroon. It's been a pleasure talking with you.
My great pleasure. Thank you.